So today's topic is micromineral iron. It's chapter 12, page 231. Those who will join late, please help them out with the page numbers. Chapter 12, page 231. So in a healthy individual, their body contains around 2.5 to 4 grams of iron in total. Okay. And since it is a very small amount of iron mineral, which is present in the whole body, okay, in different forms. It's called trace mineral. We don't require too much of this. Even though iron is a very important micro mineral, you have a daily requirement of iron, okay, but not in huge quantities like how we have salt and all. Okay. So iron is considered as a trace mineral, micro mineral, because the amount that you require for a healthy lifestyle is very less. Okay? Just like other trace minerals like nickel, silicon, vanadium, cobalt, and all, that also you require in your body, copper and all, okay? But not in too much. The amount is very less that you require on a daily basis. That's why this is a micro mineral. So around 2.5 to 4 or 5 grams total body iron is always present in a healthy individual. And most of it that you will find is in the hemoglobin. Okay? 60 to 70% of iron is found in the hemoglobin, which is present in your blood. Okay? Hemoglobin gives that red pigment to your blood. 15 to 30% is stored in your liver and your reticuloendothelial system. Okay? Reticuloendothelial system is your spleen, your bone marrow. Okay? Because this produces red blood cells. Hemoglobin is present in the red blood cells. Reticuloendothelial system produces the red blood cells. Okay? So in liver and your reticuloendothelial system, in form of ferritin in liver and hemosiderin in reticuloendothelial system, it is present. Okay, 15 to 30%. Then in myoglobin, myoglobin is the muscle protein. Okay. In your muscles also, iron is present in the form of myoglobin. And in your blood plasma, very trace amount, 0.1% in the form of transferrin. Okay, transferrin is the form of iron which can be transferred. Trans means movement. Okay, from point A to point B. So transferrin, when iron is in a movement within your blood, it's in the transferrin form. So that is 0.1%. Then we have the functions of iron. The first thing is the transport and storage of oxygen. So each gram of hemoglobin contains around 3.34 microgram of iron. And hemoglobin, it does not stay stuck somewhere. It's a red blood cell. It keeps on moving with your blood. And in myoglobin, in your muscle, this is where muscle can store oxygen. Okay? Myoglobin, it has iron and it helps in storing oxygen in the muscle. So, in transport through hemoglobin and storage through myoglobin. Okay, hemoglobin, iron is being transported. In myoglobin, iron is being stored to keep oxygen. Okay. Second is it's a cofactor of enzymes and other proteins. So iron contains this heme group which is also a part of several protein involved in the release of energy. Okay, like ATP and all. When energy is released to trap energy, this heme group is required. Conversion of beta carotene into active form of vitamin A. Beta carotene is vitamin A from plants. Okay, from plant-based diet, you get beta carotene. Your body cannot store beta carotene. It has to be converted into active form of retinol and all. Only then your body can store it, absorb it. Okay. So for this conversion, iron is required to synthesize purines within your body, which is required to make DNA and RNA. Purines are required to make DNA and RNA, and to synthesize purines within the body, iron is required. To synthesize carnitine, okay, carnitine helps in moving fat around the body. Iron is required, okay. To synthesize collagen that keeps your body youthful, okay. For that as well, iron is required. Detoxification of drugs and other toxic components from the liver and intestine. Okay, so iron plays an important role in being a cofactor for all these functions, making neurotransmitters like serotonin, dopamine, norepinephrine. These are happy hormones. This keeps your mood uplifted, mood uplifting hormones. Okay, uplifting chemicals which your body produces. So only in presence of iron these neurochemicals can be produced. Okay, this is why people who are anemic because of the deficiency of iron, they have a higher risk of going into depression. Okay, because mood uplifting hormones are not present. Then formation of the red blood cells. It's a big process. Okay, you can see here in the image given, hemocytoblast. It's a stem cell. Okay, present in your bone marrow. Over the time, this hemocytoblast, it's immature. Okay, it will undergo changes. It becomes a pro-erythroblast. Still, it is immature. Okay, then it develops further. There are phases in its development. Right, first ribosome synthesis will take place, which is DNA synthesis will take place in this cell. Then hemoglobin will accumulate. Okay, once the RNA synthesis is done, then the hemoglobin will accumulate. Still, it is in an immature form, and it becomes a normoblast, and it loses its nuclei. Okay, once the nuclei is lost, every cell will have a nucleus, right? But RBCs do not have nucleus. WBCs have nucleus. RBCs do not have nucleus. Okay. So in the starting phase, they had nucleus, but in the development, once the hemoglobin has been accumulated, hemoglobin, hemo is iron, globin is protein. This iron protein mix has been accumulated. It will lose its nucleus naturally. Okay. And once it is a cell which does not have nucleus, bone marrow will push it out of itself into the bloodstream. Okay. It is a reticulocyte at that point. Okay. Still, it requires 24 to 48 hours to mature into a complete RBC. Okay. Immature red blood cell, that is in the form of reticulocyte, is being dumped into the bloodstream. It will be circulated within the blood for 1 or 2 days, and then it becomes a mature RBC. So this is the entire process. Okay. So in the hemoglobin accumulation phase, iron is required. If iron is deficient, okay, this phase 2 of hemoglobin accumulation will be very low. Okay. So that's why the body will not be producing enough mature RBC. Okay. So for formation of red blood cells, iron is required. Okay. So coming to the absorption from the stomach, through whatever food you eat, it goes into the intestine. Okay. It is in the ferritin form. It gets into the intestine, and then it converts into it goes into ferroportin. That is a channel. Okay. Through that, it will get into the blood, and it will attach itself with transferrin. Okay. Transferrin will help this iron to be picked up into liver. Okay. Iron as it is cannot move inside blood. Okay. Iron has to attach itself with a protein called transferrin. Okay. Only then iron can circulate inside the blood. Okay. So during the circulation, it will reach your spleen, it will reach the liver. Okay. And when it reaches the liver, it detaches from transferrin and it gets into the liver in the form of ferritin. It is stored there in the liver in the form of ferritin. Okay. Even in the spleen, it detaches from transferrin, stored in the spleen in the form of ferritin. Okay. This is how the absorption of iron takes place. There is a lot of situations that should be present. Okay. If the iron is not being converted from the ferrous form into the ferritin form, it will not be absorbed. So the presence of vitamin C is required. Okay. And if ferroportin channels are not there, iron will not know how to enter the bloodstream. If transferrin is not there, if you are anemic, you will have very low transferrin levels. If transferrin levels are very low, iron, even if it is getting absorbed, it will not have enough opportunity to travel in the blood. Okay. So there is a lot of conditions that iron requires so that that equilibrium, that homeostasis of iron is maintained inside the body. So this is the absorption. Metabolism, how you lose iron? Through feces, because the iron that you eat, not all of them is absorbed by the intestine. Some of that you lose, okay, as it is. So through feces, you will lose around 11 mg. Women lose around 28 microgram of iron every month. Non-pregnant women during their menstrual loss, around 28 mg per period they are losing. Okay. Then desquamation. Desquamation, now in winters it will start. Okay. Throughout the year it's also there, but during winters, commonly you lose a lot of skin, dry, flaky skin. Okay. It is called skin peeling. Most of us will go through that. In winters, our skin gets dry. If you scratch it, it will peel off. Okay. That dry flakes will peel off, right? So that is desquamation. So through that also you're losing around 1 mg of iron. Okay. This is how iron leaves your body. Iron balance. Since iron is very essential, okay, body has a system in place so that iron balance can be maintained. Okay, we don't lose iron as it is. So what happens is that since RBCs have hemoglobin, hemoglobin is iron and a protein. Old RBC, an RBC has a lifespan of around 120 to 140 days. Okay, around 3 months ago is the lifespan of a RBC. So old RBCs, when they get born out, they go into the spleen, okay, where the RBCs are destroyed, but the heme part of it, the iron from the heme is taken up by the spleen. The remaining is dumped into the blood, and from blood it will go out of your body through feces. Okay. So that is reutilization of catabolized red cells. Catabolization means breaking down. Okay. In spleen, catabolization takes place. Breakdown of red blood cells take place. And spleen will pick up the iron from the red blood cells and dump the remaining waste. Okay. So we are not losing iron. It has been recycled in your body. Then we have an upper limit cessation in absorption. If your body has enough iron, your liver has enough iron, your spleen has enough iron, you have enough hemoglobin in the body, you don't require any more iron. Your intestine will stop absorbing iron from the food. Okay, that is upper limit cessation, so that you don't go into iron toxicity. Then ferritin levels. There is access specific storage protein called ferritin. It is there in your intestine, in your liver, in your spleen, okay, which can store excess amount of iron, so which can be used in the pregnancy, specifically last trimester, okay, so that the mothers don't become anemic. That is ferritin. So ferritin is a storage protein. There are two kinds of iron, heme iron and non-heme iron. Heme iron, the one that is bioavailable, okay, it is easily absorbed. Non-heme iron, it's ferrous fumarate. There are different names of it, so ferrous sulfate and all. It has to be converted because, see, it is ferrous. Ferrous has to be converted into ferritin. Okay, then only it can be absorbed into the system. It is heme iron is easy on stomach. In supplementation, you can take it with or without food. Take it on an empty stomach, and you don't have to worry about the stomach acid, reducing the chances of absorption. But non-heme iron, it requires acidic environment. It requires a combination of vitamin C as well. Heme iron is natural. It's not from genetically modified organisms. Okay, it's the natural form, how nature intended it to be. Non-heme iron are synthetic iron salts used in supplementation usually. Prescription level or nutritional supplementation, synthetic iron salts are used. The only situation in which the absorption of heme iron can be limited is if there is a presence of calcium more than 300 microgram per saving. Presence of calcium is there, then the absorption can be inhibited. In non-heme iron, there are so many things that can stop the absorption. Calcium, milk, coffee, tea, wine, chocolate, eating cheese, beer, okay, eggs, nuts, yogurt, whole grains, antacids, all these things, okay. A lot of things can block the absorption of non-heme iron, okay. Heme iron is found in animal food sources. Then enhanced absorption factors. How can we enhance the iron absorption from whatever food that you're eating? Increased acidity, have more citric fruits, okay? Citric food, acidic food, along with iron-rich food. That will enhance the absorption. Do not take a lot of antacids while eating iron-rich food. Okay? Animal tissue protein like meat they have a higher chance of absorbing iron as compared to plant protein or the non-tissue protein. Non-tissue protein is milk. Okay, milk has protein, but it is not from an animal tissue. Okay, milk, cheese, eggs, they don't have the same effect. But other animal tissue protein like meat, okay, organ meats, when you're consuming that, easily the iron is absorbed from that. Then body requirements. During pregnancy, naturally the requirement is high. So whatever food you are having, maximum nutrients will be taken up from that, even including iron. When there is a hemorrhage or deficiency, your body's requirement is high. So whatever iron-rich food you are eating, body will try not to waste it completely. It will take it up. Then lactoferrin and lactalbumin, presence of lactoferrin and lactalbumin is very low, especially in breast milk. Okay, so the presence of these lactoferrin and lactalbumin, it increases iron absorption. But in human milk, it is very low. Then calcium, if calcium intake is more than 300 mg in the same meal, okay, if you are having an iron-rich any fruit or vegetable, but along with that, you are having a calcium-rich food as well in the same sitting, in the same meal, that can block the iron absorption. But if the presence of calcium is less than 300 mg or less than 200 mg, that is not an issue. Okay. And what all will inhibit the absorption of iron? Low gastric acidity, decreased secretion of hydrochloric acid in the stomach. You don't have that happens when you take too much of antacids. Okay, you are dependent on too much of antacids. This inhibition can take place. Increased gastric motility. Eating too much of fiber, that everything from your intestine moves very quickly. Not enough time for iron-rich food to stay in the intestine and be absorbed. Okay. So dietary fibers like hemicellulose and all that will reduce the absorption of iron. Phytates and oxalates, like if you're having dal, okay, dal has to be soaked well, at least 1 hour to 30 minutes before cooking it. So you can get rid of the phytates. Oxalates also present in spinach and all. Wash the spinach properly. Okay. So the presence of these anti-nutrients, phytates and oxalates, will reduce the absorption of iron. Find out ways to get rid of phytates and oxalates, then eat the meal along with iron-rich food. Then polyphenols. These are organic components which are present in coffee, tea, chocolates. Okay, so when you combine your meal, whatever you eat, when you combine that with tea and coffee, iron absorption goes down because tea and coffee, chocolates and all, dark chocolate and all, will have a lot of polyphenols. Minerals, cobalt, zinc, cadmium, copper, molybdenum, okay, they have competition with iron. If you're eating food which are rich in these minerals along with iron-rich food, they will compete over each other for absorption. just like calcium. Okay, calcium will interfere with the iron absorption. Is copper, zinc, cadmium, and all. They have a competition with iron. Infection, severe infections, recurrent infections, iron absorption goes down. Then non-tissue proteins like milk, cheese, eggs. If you eat a lot of this along with iron-rich food, that they will block the iron absorption. Okay. Overload of iron, very rare, but it can take place. Like if you are cooking always in cast iron vessels, storing the food in cast iron vessels. But people who work in mining industries, especially if it is iron ores and all, they have a risk of developing hemato hemochromatosis. Okay? So too much of iron, where will it go? It will go to the liver. Okay, liver will make space to accumulate as much as iron as possible. Over the time, it accumulates more than what it is supposed to accumulate, and that will cause inflammation. That is hemochromatosis of liver. Okay, the liver, it can lead to liver cirrhosis as well if not treated. It will not take place within one day. It takes 6 months to 1 year for this situation to happen. You will not get iron toxicity within one day. Another side effect of it is the eyes will appear rusty because the iron, the ferritins and all, that will go and accumulate in the soft tissues of your body. Okay, your iris is also one of the soft tissues in the body. The iris will have a rusty appearance because of accumulation of powdered hematite or iron ore dust. Usually very common with workers who are in the mining industry, who work in the iron mines and RDA. There is a table given, okay, table 12.3 on page number 239. You can refer that. Man, woman, pregnant woman, lactating woman, okay, how much iron they have to consume on a daily basis is given. Iron-rich food sources: dates, pulses, organ meat, ragi, cereals, green leafy vegetables, curry leaves, methi leaves, garden cress seeds. Okay. There is a table given in page number 241. Animal source and plant-based source. Both are given. You can refer that as well. Liver from if you're a non-vegetarian person, animal organ meat like liver is the best source of iron. Fishes like tuna, mackerel, crabs. In plant-based sources, garden cress seeds, sesame seeds, black sesame seeds, amaranth leaves, cocoa leaves, tamarind, imli, okay, these all have iron in it. Lower sources are given at the end. You can check that. So deficiency of iron will lead to anemia, iron deficiency anemia, nutritional anemia. Okay. Either you don't have enough iron in your diet, or you suffered from a lot of blood loss. It could be hemorrhage because of accidents, or in women, if you have heavy bleeding during menstruation. Okay. In children, if they have worm infections are very common in kids. Okay. People who suffer from chronic kidney diseases, hypothyroidism, Endocrine abnormalities. Body is unable to absorb iron due to medical reasons. Some intestinal surgery, Crohn's disease, IBS is there. Okay? This can also lead to anemia. Treatment, proper balanced diet. If it is stage 1 anemia, balanced diet. With diet, you can control. Okay. But if anemia progresses to other levels, you need clinical help. Okay. Vegetables that are rich in iron, like spinach, carrot, radish, beetroots, tomatoes, potatoes, green leafy vegetables, fruits like bananas, apple, pomegranates, sapota. Iron supplements only under medical advice it has to be taken. And in severe cases of anemia, when the hemoglobin level is less than 6 or less than 7, blood transfusion is suggested. What are the symptoms of anemia? Weakness, fatigue, shortness of breath, giddiness, headache, increased heartbeat, okay, pale, dry skin, irritation in the mood. You can do simple blood tests to detect, okay, RBC count, or you can go for CBC, complete blood count. Bone marrow examination, biopsy can be done to find out how is your iron storage capacity of the body. Okay. In severe cases, bone marrow examination is done. Causes of iron deficiency, increased needs when you are growing up, from childhood, if you are moving into adolescence, specifically for girls, you have hit puberty. Your requirement of iron is more because now you're bleeding on a monthly basis, right? So requirement is more, but if you're not keeping up with the requirement with food, it can lead to anemia. Heavy menstruation. During pregnancy as well, even though you're not bleeding, the menstruation stops, but the blood volume increases in pregnancy. Okay, you require iron. And your child also requires iron because the baby's liver will also store iron. Okay, after the child is born, the child will only drink mother's milk for 6 months. It will require iron, right? Lactation, okay, cancer. In this situation, the requirement of iron is quite high. To keep up with the situation, iron intake should be increased. Insufficient intake, if you are having a vegetarian or vegan diet, you limit yourself with specific kind of diet for a time period. Crash diet like cabbage soup around. People who are malnourished. Then decreased absorption. You may have enough iron, but it is not showing up in your body. You suffer from severe peptic ulcers. You continuously take antacids for that. The acidity of the stomach has gone down. Okay, so that could affect your iron absorption. Gastric or bariatric surgery. People who have done gastric bypass surgery for weight loss and all. Vitamin C deficiency. Okay. Clinical findings, what we have seen in people who are anemic. Okay. Incompetence is seen. These kids or people, they frequently fall ill. They frequently and always fall ill. That is immunocompetence because of the deficiency of iron. Diminished work performance in school as well for children. They lose their focus at school. In work also, easily they get tired, decreased performance in work. Cognitive development as well is impacted in children who are anemic. And even through the teenage years when they're anemic. Behavioral implications. Kids who are anemic are more disruptive in classes. They are very irritable. They show a lot of temper tantrums and all. cases like Pika where kids eat chalk, they want to eat ice. Okay, that kind of situations are also seen. Coming to the physical aspect, how it is seen on the body, skin becomes pale, uh, lots of hair loss, alopecia, graying of hair, folliculitis, that is, the hair follicles will undergo inflammation, acne, nail growth will be reduced, tongue and mouth, all this will be very pale, it will be affected. Poilonychia, that is spoon-shaped nails. Okay, nails become concave and it becomes spoon-shaped. That is also seen. So in diagnosis, when you do a blood test, your serum ferritin level, serum iron, transferrin levels are checked. Okay, if it is less than 15% transferrin levels, it is deficiency. Okay, iron level, if it is less than 15 and all, it is deficiency. Hemoglobin level is also checked. That is the last stage. So treatment, oral administration of ferrous sulfate, 50 to 200 mg depending on the age group. Okay, 50 mg and all is given to school kids. 200 mg and all is given to pregnant women. Okay. So based on the age group, the doctors will determine how much mg of iron you should take. Prevention, dietary improvement has to be done. Proper diet can definitely prevent anemia. If you are a non-vegetarian, eat more organ meats, fleshy food, fish, dark fish. Okay. Regularly consume whole grains, nuts, dates, jaggery, amla, vitamin C rich food like poa, amla during pregnancy and all. Consuming sprouted pulses regularly can also help. Daily, at least 100 gram of green leafy vegetables. This is dietary improvement. This alone can help a lot. Supplementation, 20 mg, 50 mg, 200 mg, depending on the age group, these are given. Okay, adolescent girls will have at least 100 mg iron. Pregnant women will have around 200 mg iron. Okay. Fortification. Nowadays, milk powders, even the masalas and all garam masalas that you buy, attas that you buy, okay, most of that come fortified with iron. Salt as well, okay, double fortified salt, which has both iron and iodine. That is double fortified salt. It comes in this red color packet. If it is Tata salt, if it is fortified with iron, it comes in red packet. So these are fortifications that can help. Okay. Then education, specifically teenage mothers, teenagers, women who come during their first trimester to the doctor, they should be taught about importance of iron, how to eat food, what kind of food to be eaten. That comes under the education. And even in schools, the school syllabus from 6th and 7th standard onwards, school syllabus should include anemia, iron-rich food, okay, vitamins, minerals, deficiencies and all. It's included, okay, as a part of our curriculum. Promotion of home gardening. So that children from the school, they will learn this, go home and plant their own seeds, okay, of iron-rich food. Control of parasitic infections. distribution of anti-helminthic medications to control worm infections, parasitic infections in the population from the government side. Okay, that can also help. That's about iron deficiency.